Hello everyone! Today we're going to be chatting about teaching and assessment in interprofessional education. Now, this presentation isn't meant to be the be-all and end-all of teaching and assessment in IPE. Rather, these are going to be some issues and ideas that I'd like to draw your attention to. That being said, I do have a lot to cover today. So today we're going to be linking back to some ideas that we've already discussed this semester, and we're also going to be introducing some new ideas like teaching strategies and assessment, and we're going to try and fit all these various pieces together in a discussion about how to actually go about teaching in IPE. And an idea we're going to be visiting a lot today is how is teaching interprofessionally different than intraprofessionally? And I encourage you to pause for a moment and reflect on this before we continue. A lot of the basics are the same when we're talking about intra and interprofessional teaching. For example, we may use similar theories and teaching strategies, and the planning process is pretty similar with, granted, a few extra considerations. However, there are a number of differences which we'll be discussing throughout this presentation. One I'd like to highlight right now, though, is how the team dynamics would likely differ. So in an intra-professional group, let's say a group of third-year nursing students, you're likely going to see some pre-existing friendships within that group. And the same could be said about a group of nurses, say, who work together on a unit. And they'll likely have a pretty good understanding of the knowledge and skill of other people within that group. An interprofessional group is going to have some different team dynamics, however. So you'll still see those intraprofessional dynamics, and this isn't to say that, say, doctors and nurses and social workers, for example, can't be friends. But now you're compounding on other issues such as potential hierarchy issues, miscommunication due to differences in terminology or jargon that each group may use. So those issues of professionalization and power, as we discussed earlier this semester, can be at play here. And I'm organizing this talk into two parts, really. So in the first part, we're going to be looking at what I've called here tentatively educational considerations. And this is more so concerned with instructional design and constructive alignment in IPE. So we'll be talking about things like learning theories, learning objectives, teaching strategies, and student assessment when we're designing IPE. And the latter half, I'm going to be talking more about what I've tentatively called logistical considerations, like picking facilitators, booking a facility, what are some considerations for online IPE, etc. Before we jump into all of this, though, I'd like to draw your attention to this scoping review on the implementation of IPE. This scoping review provides an interesting overview of the numerous barriers to implementing IPE, as well as some key lessons for addressing these barriers, and I highly recommend checking this article out. And we're going to be touching a lot on these points today, although I am going to be focusing more on what's more pertinent to frontline educators and facilitators, for example, nurse educators. That tends to be more the demographic that I teach. And my number one tip for teaching interprofessionally is to involve the other professional groups in the planning, implementation, and assessment of the IPE activity. And this is going to be a recurring theme throughout this presentation. So if you're only going to remember one thing from this whole video, please let it be it, because this is hugely important to IPE. So with all of this in mind, let's delve into some educational considerations for IPE, starting with learning theories. So if we think back to earlier in our course this semester, we talked about how theories are different lenses through which we can look at complicated issues. And theory allows us to focus on the different aspects of a phenomenon, as well as providing a framework for us to better understand these issues. And learning theories specifically can be used as very practical tools or as a set of guiding principles to help inform our teaching, including helping us understand what is driving and impeding learning in our teaching. And this, in turn, all improves our teaching. And there are many, many different learning theories that we can use to support IPE. For example, reflective learning, experiential learning, communities of practice, complexity science. Andragogy, or principles of adult learning, is another really helpful perspective, although it technically isn't considered a learning theory anymore. And there are, of course, many other theories you could use for IPE. This is by no means an exhaustive list. But I would like to take this opportunity to insert a little PSA, if you will, that learning styles are not a learning theory. So the whole idea of learning styles is premised on this idea that learning occurs best when the content is presented to the learner in their learning style. For example, visual learners, auditory learners, kinesthetic learners. And while there are certainly differences in how people learn, this whole notion of learning styles has been debunked within the field of education. There's little to no evidence to support this idea. If you want to know more about this, I have a whole video on learning styles, why we should abandon them, and what we should do instead, which I'll link down below. Now, one of the things I like to consider when I'm selecting a learning theory or theories is what learning system or learner am I trying to target? So am I focusing on individual learners' perceptions, for example? Let's say they're perceptions of other professionals in an interprofessional team. If so, something like constructivism or social constructivism could be appropriate here, because I'm looking at the individual. Or maybe I'm trying to actually address the broader community that my learners are participants in. For example, maybe I want to address norms and practices surrounding the use of the surgical safety checklist in plastic surgery. So something like community of practice might be a better fit here. And next up is learning objectives. So a really helpful framework that you can use here to help you develop your learning objectives is the Taxonomy of Educational Objectives, more commonly known as Bloom's Taxonomy. And this is a framework for classifying statements of what we expect or intend our students to learn. So in short, within this taxonomy, there are two parts to the learning objective. There's the noun or the content, which in Bloom's taxonomy is called the knowledge dimension. And then there's the verb or the action, which needs to be measurable, very important, which is known as the cognitive process dimension. And within Bloom's taxonomy, there are different types of knowledge, which I talk about a little more in depth in a different video. And the cognitive process dimension is what I think most people are probably familiar with when they think of Bloom's taxonomy. The 2001 version contains 6 categories that include remember, understand, apply, analyze, evaluate, and create. And as you work up this pyramid, the categories get more complex. A reading this week by Van Digel et al. Recommends consulting existing interprofessional competency frameworks when you're determining your outcomes. For example, the Canadian Interprofessional Health Collaborative's National Interprofessional Competency Framework that we've talked about a few times in our course. And I'll link that down below in the description. Something we want to consider from all of this is the idea of constructive alignment. Namely, are our learning objectives or outcomes aligned with the teaching strategies and activities or assessments that we're using? So as this figure shows, the learning objectives are related to our selection of teaching strategies and assessment strategies. So is there consistency between the learning objective, the teaching strategy, and the assessment strategy? And the chapter Matching Methods with Message in Teaching Made Easy, a manual for health professions, uses swimming as an example to illustrate this, and I think it's a fabulous example. So let's say your learning objective is that you want your learners to be able to swim by the end of a learning session. So you need to pick a teaching strategy that's actually going to get your learners in the water and puts them in the pool. But if your learning objective is to show your learners that swimming is fun, you could invite people to come to your class and share their experiences with swimming, or you could show them images of people or videos of people having fun in the water. And these examples show constructive or instructional alignment between your learning objectives and your teaching strategy. And we can extend this same thinking to include assessment. So if we're hoping that by the end of a learning session, someone knows how to swim, perhaps our learning objective is that by the end of the lesson, the learner will be able to swim across the pool. And that type of assessment works great if that's our learning objective, but of course this assessment wouldn't make much sense if our learning objective was to show learners that swimming is fun. Because if they're already convinced that swimming's not fun and they're not a good swimmer, they're probably not going to have a lot of fun if you make them swim across the deep end. So a few questions for reflection. So I encourage you to think about an IPE activity that you've participated in. This could be as a healthcare professional or an educator. It could be something that's in the workplace or an in-service or something even pre-licensure. What were the learning objectives? And do you think that the activities that you did actually accomplished these learning activities? How did they or did they not do so? Teaching strategies. There are so many different teaching strategies that you can select for IPE. But before we go into actually selecting our teaching strategies, I think we need to kind of redefine our role as an educator here. Or as the Van Digel reading says, we need to be facilitators in IPE rather than lecturers. While we may be content experts in our own professions, we are not going to be content experts in every other discipline or field. So we need to be focusing on facilitating discussions rather than lecturing students. And Van Digel and colleagues proposes a 90-10 rule. So you should be listening 90% of the time and then talk for about 10% of the time when it comes to IPE. And they also encourage peer teaching and learning wherever possible. So now that we've put on our facilitator cap, let's talk about teaching strategies. A difference between intra and interprofessional learning here is that in intraprofessional learning, we tend to include a combination of different teaching strategies that are more individualistic as well as some group activities. However, in IPE, the majority really should be group-based so they can get the most out of the experience. So this can include some individual learning activities, such as reflective journaling, but we want to take advantage of this opportunity to learn from one another, because after all, IPE is about learning with, from, and about other professional groups. So we really should consider teaching strategies that are more interactive learning. Freeth and colleagues share this really great table that highlights some of the interactive teaching strategies that you may want to consider. Problem-based learning, for example, is an extremely popular teaching strategy in IPE. A recent systematic review that looked at undergraduate IPE found that simulation, e-learning, and PBL were the most commonly reported teaching strategies for IPE. And in another book written by the same authors who developed this table, they argue that didactic teaching or received learning doesn't really have a place in IPE because IPE is inherently interactive by definition. They do acknowledge, however, that we can use this sparingly and it can have a place in our teaching. For example, providing some background information or responding to questions that may arise from more interactive learning. And I do tend to agree with the authors here, particularly because of how difficult it is to gather all these different professionals together, whether they be pre-licensure or post-licensure. The scoping review I mentioned earlier talks a little bit about how scheduling and different timetables can make this sort of thing very difficult. So any time that you can actually get everyone together at the same time is precious time, so use it very wisely. A flipped classroom approach could be a really great way of accomplishing this. So in a flipped classroom, everyone is provided with the same information prior to the learning activity. A benefit of this in IPE is that it, in a sense, levels the playing field because everyone is attending the learning session with the same assumed knowledge from the pre-class materials. And it also frees up some of the time during the actual session so you can have some more interactive or student-centered learning activities. And when we're picking an appropriate teaching strategy, we need to start with considering our learning theory or our learning theories and our learning objective because we want to ensure we have that constructive alignment. A learning portfolio would be well aligned with reflective learning, for example, especially if you have a learning objective about professionals reflecting on their own interprofessional practice. Group reflection and debriefing with peers also work really well with reflective learning theory, and problem-based learning and simulation are very nicely aligned with principles of adult learning. Actually, PBL and case-based learning as well are actually nicely aligned with experiential learning, and those two are actually among the most frequently used teaching strategies in IPE across the board. So I want you to think back once again to an IPE activity that you have participated in. What teaching strategies were used? And did you think the teaching strategies were effective in meeting the learning objective? And how did they or did they not do so? And next up is assessment. Now here I'm talking about student assessment rather than the evaluation of an IPE program. So for those of you who have not taken an assessment course, there are two overarching types of assessment, summative assessment and formative assessment. And the big difference between the two is the timing of the assessment as well as the use or purpose of the assessment. So summative assessment is higher stakes assessments and it's conducted at the end of the learning process. For example, this could be at the end of a module or at the end of a course. Summative assessment is used to support decision making and reporting of achievement. For example, did the learner meet the learning objectives? So it's really a snapshot of the learner's achievement at that point in time. And while a lot of people tend to conflate this with testing and exams, which granted does fall under summative assessment isn't limited to just that. And the second type is formative assessment, which is lower stakes assessments that are conducted during the learning process. So it's really more about learning and development and providing information on their learning that can inform subsequent learning. Formative assessments are more informal and they usually aren't graded, although they can be, but if they are, they usually have a pretty small value towards a grade. And when you're reading through literature on assessment, you may also come across assessment of, for, and as learning when discussing purposes of assessment. So assessment of learning is really referring to summative assessment. So it's looking at measurement of learning and learners' achievement. So it's literally assessment of what they've learned. Assessment for learning is formative, so it's concerned with supporting the students' learning through the assessment process. It involves looking at where learners are currently at and then where they need to go. And this involves a combination of providing students with feedback as well as adjusting our own teaching as needed. And learning as assessment is more concerned with learners' metacognition. With assessment as learning, we're engaging learners in their learning, such as through self-assessment and self-directed learning, having them set goals, etc. So it's assessment-like interactions between the educator and the learner, such as questioning. And here, assessment is literally seen as a learning opportunity. And much like we did with teaching strategies, we want to consider our learning theory and our learning objectives when we're figuring out our assessment strategies. So does the assessment strategy make sense in light of your learning objective, for example? So for example, if we want our learners to remember or understand something, we may be able to do something like an exam. But if we've used a cognitive process domain that's higher in complexity, we may be doing something such as having them engage in a case study and assessing their answers to that, for example. Or even engaging in PBL. But there are certainly some challenges to assessment in IPE. A major issue here is that there isn't very much literature that talks about student assessment with IPE. I certainly had a hard time finding literature to inform this part of my talk, so that can certainly be a challenge when you're looking at assessment in this area. When you do look at the literature, it tends to focus more on learners' attitudes towards IPE, as well as their readiness to participate in IPE, and assessment tools tend to be very focused on self-reported change from the learner. Further challenges that you can encounter are different theoretical frameworks across professions and different standards mandated by different professional bodies. Additionally, those conducting the assessment may not feel confident in their ability to assess students from a profession other than their own. So a few things to keep in mind when we're talking about assessment in IPE. So when we're assessing our learners in IPE, we should really be looking at professional skills. For example, communication, teamwork, conflict resolution. And you should clearly articulate this to your learners and anyone else who may be involved in the assessment process. So it needs to be very clear that you're focusing on team collaboration rather than profession-specific competencies. And that's not to say that you can't include some profession-specific competencies for each of the professions, though. For example, you could do a mix of profession-specific competencies, followed by their interprofessional skills, and then maybe some written feedback for them to reflect on. When designing your assessment strategies, you should have input from people across all the professions who are going to be participating in the assessment. So if you're planning an IPE session for medicine, nursing, and social work, you need to get input from medicine, nursing, and social work on the assessment strategies and tools that you're planning on using. And this is important for a couple of reasons. One, it ensures commonality across all of these professions. And two, it allows you to clarify how the assessment outcomes may be applicable to their professions. Feedback from different professional groups may also promote reflection on professional skills like communication and use of terminology. This is one opportunity where you can use peer assessment, actually. However, when we're doing peer assessment, we want to ensure we have clear assessment criteria and that we're very transparent about the process so learners don't view it negatively. And when formulating your assessment plan, like always, you should consider your learning theory, your learning objectives, and your teaching strategies to ensure your planning has that instructional alignment. So for the third time, think back to an IPE activity that you've participated in. What sort of data, if any, was collected to evaluate the achievement of the learning objectives? What elements were there of assessment of, as, and for learning? And do you think the assessment strategies were effective in measuring your achievement of the learning objectives? And how did they or did they not do so? All right, with all that stuff out of the way, let's get into some of the more practical considerations when we're planning an IPE session. And of course, considering theory and constructive alignment are all very, very important, but there is so much more that goes into planning an IPE session. So let's get into some of the more logistical considerations. So the first one I want to bring up is considering credits. So if a course or a workshop is going to be worth credits, whether it be pre-licensure training or some type of CPD, this is something we need to think of very well in advance. This takes quite a bit of time. You're going to need to involve the other professional groups, the institution, possibly accreditation groups, like if it's CPD, and this is a big undertaking. With credits, make sure you're thinking of all of the different professional groups that are involved. And Freeth et al. Brings up a really interesting point about this idea of credit in IPE. And they use the example of an interprofessional placement for pre-licensure medical, nursing, and dental students. The medical and dental learners received educational credit for this course, but the nursing students did not, which resulted in resistance amongst the nurses and reduced motivation on their part. So that certainly isn't role modeling or going to foster good feelings when it comes to interprofessional collaboration. I will add one area here where it can be a little different and a little tricky is within continuing professional development. So for example, in Canada, the medical profession has a very structured system for their CPD, whereas nursing frankly really doesn't. So an IPE CPD course may say it's approved for X number of main pro credits, for example, but it may not say anything like this for nursing because nursing doesn't really have that in Canada. So this is just something you want to keep in the back of your mind. Will your educational session be mandatory or optional? So mandatory sessions will, of course, support attendance and participation because it's mandatory. However, if it's optional or an elective, the learners who do choose to participate are going to be more motivated and they're going to be more interested in IPE generally. So there's kind of pros and cons here to both that you need to consider. Selecting facilitators. So in a lot of IPE events, at least that I've taken place in, what they've done is had like a course lead or course leads, and then a team of facilitators who lead the small group work. So when I used to volunteer at the Center for IPE at the University of Toronto, they'd have these huge sessions with probably at least a couple hundred students. And of course, the course leads can't be at every single table with that many students. So they had learners in about groups of 8 to 10, I would say, with a facilitator who was assigned to each group. So some considerations you want to have in mind when you're selecting facilitators if you're using them. In intra-professional teaching, this is usually professionals from the profession that's being taught. Intra-professional education for dental hygiene students, for example, will likely be facilitated by dental hygienists. With an IPE, you really want to try and have a mix here. So let's say we're doing a IPE session for nursing, medicine, pharmacy, and occupational therapy trainees. Having only physicians as the facilitators or only nurses as the facilitators is really not going to be in the spirit of IPE. So we want to ideally have representation from each professional group. And also having an interprofessional group of facilitators role models interprofessional leadership and collaboration to your learners, and it can also create a more egalitarian power structure within the session. Often in these sorts of things, the facilitators are post-licensure healthcare professionals, but peer facilitation is absolutely also an option. And in terms of the number of facilitators, it's really going to depend on what kind of model you want to use. So you could do one facilitator per small group of students. You could have a couple people even co-facilitating. An advantage of co-facilitating actually would be that right within that small group, these two people can role model interprofessional collaboration. And then you also have two people working together who they can fill any gaps and bounce off of each other. It makes it a little easier. And when considering who is going to facilitate, You want to consider potential facilitator skills, such as any training or experience with teaching and facilitating, any experience working in interprofessional groups, knowledge of interprofessional team dynamics and conflict resolution, ideally. And if they're teaching online, you want to get an idea of what their digital literacy is like. And of course, finding people who tick all of these boxes is quite challenging, so you really want to prioritize which skills are going to be most important. And you can also do some facilitator training, which brings us to training the facilitators. So we want to make sure our facilitators know how to facilitate rather than instruct or lecture. So we want to ensure they're trained in how to pose questions and reframe statements. As mentioned at the beginning of this talk, this isn't so much about being a content expert within your profession here, because you're not going to be a content expert in every professional group, nor does being a content expert make someone an expert facilitator. You and any other facilitator should have a general understanding of the role of each profession that's involved in the IPE activity. This does not mean that you need to be an expert in each of the professional groups' training, their scope of practice, etc., but you should make a genuine effort to at least learn a little bit about them. Ensure your facilitators are familiar with any technology that you're going to be using during your session. This is extra important if you're doing e-learning. And also, you and your facilitators should be prepared to accommodate for the various learners you're going to have, because they can all be at very different points in their training, so their level of expertise and enthusiasm may be a little bit different. For example, some may be coming with a wealth of clinical experience at this point in their training, while others may have just been in a lab thus far. And I think this would probably be a very good point to touch on in your facilitator training. Next up is securing the physical space and resources in advance. So for in-person sessions, we want to make sure we secure all this very well in advance. I feel like I go on a lot about space and place and physical affordances a lot of my courses, but it is really important. So booking the right teaching facilities. Since IPE activities should be by their nature quite interactive, you want to make sure the physical space is going to allow for this. I can tell you from experience that it is very difficult to do an interactive workshop that uses, say, a teaching strategy like PBL or case-based learning when you're in a lecture hall and the seats and tables are bolted down. Ensure that there's no competing courses or events that day, and this is for all of the professional groups that are going to be involved for the session. And likewise, make sure that the day and time doesn't conflict with work schedules. And this can be extremely difficult with adult learners, especially within health and social care professions, in my experience, because we can't just shut down a hospital for a day so we can have a professional development day. And Freeth et al. Mentions that care providers may not be able to attend all of our sessions, and they also could get paged halfway through a session. So they suggest that trying to do group work over lunch may work a little bit better. As an educator, I advise being very flexible here and being patient with your learners. People may be going in and out of the room. They may get calls they need to take. Health professions education can be a little complex and messy, but that's what makes it very fun and very challenging for us as educators. So if you're doing a face-to-face IPE session, you may want to consider catering. Having something available for attendees, even if it's just coffee, fruit, or some muffins. It seems minor, but this can be a very effective icebreaker. And I will say anecdotally that you get much better turnout if you've got food and beverages, and it is very much appreciated, especially if you're doing hospital-based IPE, especially if you're asking people to come to an educational session during their lunch break. A few considerations if you are teaching IPE online. So for online IPE, this of course is going to look a little bit different. Something you may want to consider doing is creating pre-assigned breakout rooms. Video conferencing services like Zoom will often let you divide up attendees into virtual breakout rooms. And you could just do this randomly during the session, or you could pre-create them, which I think is probably the better way to go for an IPE event, because you can do your best to try and ensure you have some equal representation of different professions within the breakout groups. It's also handy for the facilitator because then they're going to know a little bit more about who's in their group, ideally like their professional background. You should also identify dedicated people to manage technology during the session. For example, who's going to monitor the chat, who's going to admit people into the session from the waiting room, managing breakout rooms, or just general tech issues, because they happen. And if you're teaching an asynchronous course like this one, you can do something similar by teaching learners in interprofessional groups and giving them a space where they can meet asynchronously to talk. I also like to give my learners options to meet synchronously if they choose to, even if a course is asynchronous, because some people just prefer that. For online IPE, you also need to think about access to technology, including hardware, software, and equipment. So do your facilitators have access to a half-decent computer? Do they have reliable access to the internet? What about microphones, speakers, webcam, if that's all applicable to your course? And for online synchronous IPE, make sure you're allowing for extra time. And I think this is probably one of the best tips out there for any sort of synchronous class. So synchronous e-learning sessions can be a lot more time-consuming than traditional in-person learning because technology often does not cooperate. And you'll also have different skills levels with tech. As I'm sure many of you have experienced, especially over the course of the pandemic, There can be issues with presenters sharing their screens, switching between presenters. Maybe they go to show a video and the audio doesn't work. And as CARPA 2001 points out, these seconds really do add up over the course of an entire session. So here the authors recommend adding about an extra 30 minutes to how long the session would have been face-to-face. So if it's normally a 2-hour workshop in person, then you should schedule it for 2.5 hours online. My next tip is to share your materials in advance. So regardless of whether your session is in person or online, decide what your learners should be receiving in advance. For example, if you're doing a flipped classroom approach, this needs to be decided very much in advance. So you may choose to send out these materials via email, or you may choose to use a learning management system like Brightspace or Edmodo. Another thing you can do in advance is providing your facilitators with supporting resources, such as the facilitator's manual that addresses both the materials in their facilitator training, along with any additional supporting information that may help them. For example, you could include a timetable for the day, rubrics for assessment, a troubleshooting guide, contact information for whoever is going to be helping them out with the tech if there's an issue with that. This helps maintain consistency between the facilitators, and it makes it so the facilitator can really focus on actually being a facilitator. Most of the workshops that I've been part of have had a facilitator guide, and they are very, very helpful. Next up is considering the size and the mix of the learner groups. So with IPE, small groups are preferable. This allows for a little bit more flexibility in our teaching, and it makes it more of a community-like environment. Within the literature, some people recommend groups of 10 to 20 or even up to 20 to 60 for an ideal class size. Of course, for some teaching strategies, you will need them in smaller groups. For example, in case-based learning, it can be very difficult to manage a group of more than 15 interprofessional participants. And our chapter by Freeth et al. Recommends small groups of about 8 to 10 people for IPE, which I think is pretty reasonable. Evans and colleagues also talks about using groups of 8 students. Try to mix up the groups as best as you can and try to avoid groups made up from largely one profession where possible. Sometimes this isn't completely possible. For example, in this program, there tends to be more nurses, and other professions tend to be more underrepresented, especially like social work and occupational therapy, dental hygiene. So discussion teams in my class, for example, they do tend to be a little bit nursing heavy. And this is something that facilitators should be aware of, as well as how it can be stressful for individuals who are in a professional group that isn't as well represented within that student group, because they may feel like they need to speak up more to have their profession heard. And a few considerations for the actual day of. So first is setting up the physical space. So try to get there early to set up your space. Consider the configuration that's going to work with your teaching strategy. For example, a U shape can work really well, and the facilitator can sit in the open part of the U, and everyone can make eye contact with each other. If you've seen any of the classrooms within our faculty, especially the ones that are used more for the PhD program, you'll see the U shape a lot. You also want to make sure everyone can actually see any materials you are displaying, like presentations or results for something like a Kahoots quiz or poster papers, whiteboards, etc. Alternatively, you may want to opt for a different layout depending on the activity you're selecting, like having small groups. And this is the place where you can actually really apply learning theories, because different learning theories will support different room configurations. And I'll link a good article on this or down below. I think I have a video on this too. Alternatively, you may be doing something like a simulation in your workplace, where most of the time you're going to be in the clinical environment or in a lab, and you may not go into a more traditional classroom setting except for perhaps for a briefing or a debriefing. Next is setting the emotional and social environment. So we want to create a supportive and inclusive learning environment so our learners are actively engaged in the learning experience. For online IPE, you can encourage your learners to use the chat feature when they're asking questions and posting resources for each other. A great way to encourage this is by having everyone introduce themselves and their profession in the chat at the start of the session. Not only does this give learners a chance to learn how to actually use this feature, and you can use it for attendance too, but it also shows the students that it is okay to use the chat feature in your class. Providing support for the facilitators. If you're in a position where you're the course session leader, make sure you're providing support to your facilitators during the IPE session. And if it's an online program, make sure all of your educators and facilitators have access to IT support. Something might come up that's beyond your abilities, so make sure you and they know who to contact in such a case. And managing anxiety and conflict. So within IPE, some people may feel anxious about speaking up within the group due to power structures, hierarchy, and concerns about conflict. In the past, I've had learners afraid to speak up in IPE activities because they don't want to sound stupid in front of physicians. I've also seen physicians who actually don't want to speak up because they don't want to be seen as dominating the discussion, or refusing to take leadership positions because they're concerned about being perceived as the de facto leader just because they're in medicine. In my experience, I find icebreakers can really help when you have learners introduce themselves, their profession, and sometimes I'll ask them a question about their profession, like why they chose it or what they love about their profession or working in healthcare. A lot of times people will have the same answer for that question despite being from different professions, and sometimes this helps them see some commonality in my experience. And giving your facilitators name tags that also state their profession can help dismantle power structures within your IPE session. For online teaching, I think a good equivalent could be having facilitators put their profession after their name in brackets if that's possible. And this also can tie into that idea of the facilitator's role modeling IPE. And when it comes to issues of socialization and perceived status differences, we need to actually address these issues with our learners. From my own experience, I will say that learners are very, very aware of these issues, and I don't think it's helping anyone to pretend that they don't exist or that students aren't aware. I've had to facilitate some workshops on interprofessional communication that didn't address this. My group ended up talking about power, socialization, and how to actually talk to each other because that's what they wanted to learn. And actually being able to hear that from each other and hearing that, like, yeah, the lab loves it when you call them down and ask the question. The pharmacy's fine with you asking them a question or having a concern about meds. And that's what they wanted to talk about, not about another communication tool that tells us how to structure our conversations with physicians. And that's all for now, folks. If you have any questions about teaching and assessment in IPE, do let me know, and I will see you all online.